How to spot atypical stroke symptoms. Imagine feeling perfectly fine one moment and then noticing something unusual the next. Recognizing atypical stroke symptoms can be tricky because they don't always look like the classic signs. While sudden weakness, facial drooping, or speech trouble are well known, atypical symptoms can be more subtle and diverse. Some people might experience unusual pain, changes in their mental state, or sensory issues that don't fit the typical picture. For example, sudden facial pain or nerve pain in the face, which might seem like a dental issue, could actually be a sign of a stroke affecting certain brain areas. Changes in consciousness, confusion, or disorientation can also be signs, especially if they happen suddenly or worsen quickly. These symptoms are often mistaken for other conditions, so it's important to stay alert. Women may show different signs compared to men. While men often present with the classic symptoms like weakness or speech problems, women might experience headaches, facial numbness, or unusual sensations. Recognizing these subtle signs can make a big difference in getting prompt treatment. Dizziness or vertigo that is sudden and persistent can also be a warning sign of stroke, especially if it is accompanied by unsteadiness or difficulty walking. These vestibular symptoms are sometimes overlooked but are important clues, particularly if they come on suddenly and don't improve. Behavioral and mental changes can also be signs of an atypical stroke. Sudden confusion, trouble understanding or speaking, or even hallucinations can occur. These symptoms might be mistaken for psychiatric issues or other illnesses, but they could be signs of a stroke affecting parts of the brain responsible for cognition and perception. Sometimes, people experience nausea, vomiting, or unexplained malaise that might seem unrelated but could be linked to a stroke, especially if they happen suddenly and without clear cause. If you notice any sudden change from your usual state, whether it's confusion, dizziness, or unusual pain, it's crucial to seek medical help immediately. Early diagnosis and treatment are key to improving outcomes. Healthcare providers often use advanced imaging like magnetic resonance imaging to identify strokes that present with atypical symptoms. Education about these less obvious signs is essential for both the public and medical professionals to avoid missed or delayed diagnoses. Remember, every individual's experience can be different, so trusting your instincts and acting quickly can save lives. Always consult a healthcare professional if you suspect a stroke, even if the symptoms seem unusual or mild.